It's roughly 30,000 years ago. You wake up with a fever. Your leg has a deep gash that's turning an unpleasant shade of yellow. There is no hospital. There is no pharmacy. There is no Google search for, "Is this normal?" followed by immediately assuming you're dying. There is a fire, a handful of plants someone in your group knows about, and the collective medical knowledge of maybe 40 other people who are relying on memory, trial, error, and the occasional miracle to keep each other alive. And here's the thing that should genuinely surprise you. They weren't doing nothing. They weren't just lying there waiting to die or praying to the sky and hoping for the best. Ancient humans, going back tens of thousands of years before anything resembling modern medicine existed, were practicing something that looks, when you actually examine the evidence, remarkably like healthcare. Not advanced healthcare. Not safe healthcare by any modern standard. But organized, intentional, surprisingly sophisticated attempts to diagnose, treat, and heal each other. So what did ancient humans actually do without doctors? The answer involves bone setting, plant chemistry, dental drilling, brain surgery, and a level of caregiving that genuinely puts a lot of modern healthcare systems to shame. Let's get into it. The first thing you need to understand is that ancient humans were not working from zero. They had something doctors today still consider one of the most valuable diagnostic tools available. Time. Lots and lots of time, spent watching, observing, and remembering what worked. Hunter-gatherer societies passed down medical knowledge orally across generations, the same way they passed down hunting techniques and stories about the stars. A grandmother who knew which leaves stopped bleeding faster than others, which roots reduced fever, which berries caused vomiting, and which ones cured the runs, was an enormously valuable member of the group. This knowledge wasn't written down because writing didn't exist yet. It was memorized, tested, refined, and transmitted person to person across thousands of years. Modern researchers studying surviving hunter-gatherer groups have documented pharmacological knowledge so extensive that it rivals small modern pharmacies, except every single remedy was discovered through direct, sometimes fatal, trial and error by real people over unimaginable spans of time. Let's start with the most basic and most universal problem ancient humans faced. Wounds. Cuts, gashes, animal bites, the inevitable consequences of hunting large animals with sharp sticks and occasionally losing the argument. Open wounds were a constant threat, not because the cut itself would kill you, but because infection would. And here's where it gets genuinely impressive. Ancient humans across multiple unconnected civilizations independently discovered something that wouldn't be scientifically explained for tens of thousands of years afterward. Certain molds and plants have antimicrobial properties. Honey, for example, was used as a wound dressing by ancient peoples across Africa, the Middle East, and Europe, completely independently of each other. We now know honey has genuine antibacterial properties. It's highly acidic, it's low in moisture, which starves bacteria, and certain types produce hydrogen peroxide as a natural byproduct. Ancient healers had no concept of bacteria. They had no microscopes. They just noticed, over countless repeated observations, that wounds packed with honey healed better and got infected less often than wounds that weren't. So they kept doing it, generation after generation. Pure empirical observation, completely divorced from any theoretical understanding of why it worked, and it worked anyway. Maggots are another genuinely wild example. Several ancient cultures, when treating severe wounds, deliberately allowed maggots to colonize them. This sounds horrifying, and to modern sensibilities it absolutely is, but the maggots would consume dead and infected tissue while leaving healthy tissue alone, effectively performing a kind of natural debridement. This wasn't superstition. It was observed, tested, and reapplied because it demonstrably improved outcomes. In fact, maggot therapy is still used today in some modern medical settings for treating certain chronic wounds because it turns out ancient humans were onto something real, they just had no idea why. Now let's talk about broken bones, because this is where the archaeological evidence gets genuinely astonishing. We have found skeletal remains, tens of thousands of years old, showing fractures that healed in correct alignment. Not crooked. Not fused at strange angles the way an untreated break naturally would. Properly set. Which means someone, with no medical training in any formal sense, manually realigned a broken bone, immobilized it, and kept the patient still and fed long enough for it to heal correctly. This required real anatomical understanding. You had to know how the bone was supposed to sit. You had to apply the right amount of force to realign it without causing further damage. You had to construct some kind of splint, likely from wood, bark, or stiffened hide, and somehow convince a person in significant pain to keep that limb immobile for weeks while the rest of the group continued hunting, gathering, and surviving without them. Some skeletal remains show evidence of healed fractures in multiple bones across a single individual's lifetime, meaning this wasn't a one-time lucky outcome. It was a repeatable, working medical practice that groups across completely different regions and time periods all arrived at, independently, because broken bones are a universal problem and effective bone setting is a discoverable solution. Now, amputations. This is where things get almost unbelievable. In 2022, archaeologists working in Borneo discovered a skeleton dating back approximately 31,000 years belonging to a young individual who had part of their lower leg surgically amputated and who survived for years afterward. The bone showed clean healing, with no signs of infection that would have killed them in the immediate aftermath of the procedure. This means someone in a tropical rainforest environment 31,000 years ago performed a surgical amputation precise enough to avoid hitting major arteries, managed to prevent fatal blood loss, prevented infection in an environment absolutely teeming with bacteria, and then the patient lived long enough afterward for the bone to fully remodel. That is not luck. That is not an accident. That is applied surgical knowledge, executed successfully, in conditions that should make any modern surgeon's blood run cold just thinking about it. And this find pushed back our understanding of surgical capability by tens of thousands of years compared to what researchers previously assumed was possible. Then there's trepanation, which might be the single most extreme example of ancient medical intervention, and it deserves a closer look because it's almost too strange to be believed. Trepanation is the practice of drilling, cutting, or scraping a hole into someone's skull while they are alive on purpose. And we have found trepan skulls from cultures all over the world, completely unconnected to each other. Ancient Peru, ancient Greece, Neolithic Europe, parts of Africa, all independently arriving at the same extreme medical intervention. The remarkable part isn't that they did this. The remarkable part is that many of these skulls show clear signs of bone regrowth around the edges of the hole, which means the patient survived the procedure, sometimes by years. In some archaeological sites, survival rates for trepanation, based on bone healing evidence, appear to be astonishingly high, in some cases estimated at over 50%, performed with stone tools with no anesthesia beyond whatever plant-based sedatives were available, and no understanding of germ theory whatsoever. Why did they do it? The leading theories suggest it was used to relieve pressure from head injuries, to treat severe headaches or seizures believed to be caused by something trapped inside the skull, or in some cultures, to release what they believed were evil spirits or supernatural forces causing illness. The reasoning was almost certainly wrong by modern standards. But in cases involving real physical trauma, swelling, or pressure buildup inside the skull, the actual physiological effect of trepanation may have genuinely helped, even if the people performing it had completely the wrong theory about why. It's one of the strangest examples in the entire history of medicine. A treatment that worked, sometimes, for reasons the people performing it didn't understand, arrived at independently by cultures with zero contact with each other, all converging on the exact same extreme solution. Now let's talk about teeth, because dental problems were probably one of the most relentless and miserable aspects of ancient life, and the evidence for ancient dentistry is honestly incredible. In 2017, researchers studying a 14,000-year-old tooth found in northern Italy discovered clear evidence of dental work. The cavity had been cleaned out using a sharp stone tool, in a manner consistent with deliberate, careful drilling. This predates any previously known evidence of dentistry by thousands of years. Even more remarkable, researchers have found ancient teeth with fillings made from materials like beeswax, used to seal cracks and reduce pain from exposed nerve tissue. Someone, thousands of years before toothpaste existed, figured out that packing a cracked tooth with a sealant reduced pain and prevented further damage. That is functional applied dental science, discovered entirely through observation and necessity. Childbirth deserves its own mention here because it was, for the vast majority of human history, one of the most dangerous events a person could experience, and ancient communities developed surprisingly sophisticated responses to it. Experienced women within groups, the equivalent of midwives, accumulated extensive knowledge about labor, positioning, and complications, knowledge passed down through direct mentorship from older women to younger ones. Certain plants were used to induce labor when it was delayed, others were used to manage bleeding afterward. Communities understood, long before any formal medical theory existed, that cleanliness during childbirth mattered, that certain herbs could ease pain, and that the position of the birthing person could make a dangerous delivery more survivable. This knowledge saved lives, even though formal obstetric medicine as we understand it today was still tens of thousands of years away. And then there's mental and emotional distress, which ancient communities also recognized and responded to, often with more communal compassion than people assume. Severely disabled or chronically ill individuals were not simply abandoned. We have found skeletal remains of people who survived for years, even decades, with conditions that would have made them completely unable to hunt, gather, or contribute physically to group survival. Someone fed them. Someone protected them. Someone made the deliberate, resource-costly choice to keep them alive, not because it was strategically necessary, but because that is apparently what humans have always done for each other when given the chance. So if you put all of this together, what you get is not a picture of ancient humans helplessly suffering and dying at the mercy of a world they didn't understand. What you get is a picture of constant, motivated, empirical experimentation. Watching what worked, repeating it, discarding what didn't, passing the results down across generations through nothing but memory and direct teaching, with no written records, no laboratories, no microscopes, and somehow arriving at functional treatments for wounds, fractures, infections, childbirth complications, dental disease, and even, in the most extreme cases, brain trauma. They didn't understand bacteria. They didn't understand anatomy in any formal scientific sense. They didn't have anesthesia, antibiotics, sterilization, or any of the tools that make modern medicine reliably safe. And yet, through sheer relentless trial and observation across tens of thousands of years, they built something that functioned. Imperfectly, often at devastating cost. But it functioned. The honest, complete answer to what ancient humans did without doctors is that they became doctors. Not formally, not with diplomas or institutions or theoretical frameworks, but functionally, practically, through necessity. They developed surgery, pharmacology, dentistry, obstetrics, and wound care independently, repeatedly, across every corner of the inhabited world. Every time you take a painkiller, get stitches, or have a cavity filled, you are benefiting from a chain of trial and error that stretches back not centuries, but tens of thousands of years, to people sitting around fires, watching what worked and passing it on. They didn't have doctors, so they became something almost as good. And in some specific, astonishing cases, like that 31,000-year-old amputation survivor, they did things that should, by every reasonable expectation, have been impossible. So tell me, if you had to survive without modern medicine, using only what your ancestors figured out, do you think you'd make it? Let me know in the comments.